Hello and welcome to Health Matters. It's good to have you with us again. I am Mary Alale Yusuf. Have you ever seen anyone coughing, short of breath, and complaining of tightness in the chest? The person could be having an asthma attack. Asthma attacks all age groups, but often starts in childhood. The World Health Organization says that asthma is underdiagnosed and undertreated. It also estimated in a fact sheet updated in 2013 that 235 million people worldwide suffer from asthma, and the numbers are rising. In spite of all this, the primary health body believes that the cost of asthma to society could be reduced to a large extent through concerted international and national action. To discuss this condition on the program with me is Dr. Efumbo Dosekun. She's a consultant pediatrician and CEO of Outreach Women and Children's Hospital in Lagos. You're welcome to the show, Doctor.
Thank you very much.
Now, there was a lot of explanation there, but we didn't actually say what asthma is. What is it?
Well, asthma is a very interesting condition because it's a chronic condition. So quite a lot of times you don't even know you have it.
That means long-standing.
It's long-standing. It goes on for a long time. And you might actually have asthma and you don't know it till you meet what they call a trigger.
Okay.
So if you have an interplay with a trigger, then the symptoms would come out. So it's a chronic inflammatory disorder of the airways. The airways are the tubes that are in your lungs that allow oxygen to come in to the lungs to be fed to the rest of the body and carbon dioxide to go out.
Okay, so it's the lung now that the asthma affects.
Yes.
Apart from coughing, sneezing, chest tightness, are there other symptoms?
Very frequently, asthma is, there are two types of asthma. There's the extrinsic and the intrinsic. The extrinsic form, which is the more common form, is the form that's linked with allergies.
Okay.
So in people with asthma, they may also have other symptoms of allergy. That when you just say allergy, it just means that your body, you are that type of person that when your body comes in touch with allergens are substances that induce an inflammation.
Okay.
So things like, it could be eggs, it could be cockroaches, it could be house dust mites, there could be peanuts that would actually trigger off this, that would actually set inflammation in your airways. Your airways are like a tube. Outside, there's muscle. In there, there's what you call an epithelium, like a lining when you have a dress and you have a lining here. And there's a central part here through which the air goes in. So when this is sensitized by allergens, it becomes red.
Okay. We've gone off talking about allergens now.
Yes.
Are you saying that asthma is an allergy or is just closely linked?
No.
With allergies?
Asthma is one of the allergic conditions that human beings have. It's just that it affects your lungs. Sometimes it could affect your skin, in which you call that atopic eczema.
Okay.
Or in some other people, it might be when they are challenged with some chemicals or some noxious substances, and they call that contact dermatitis. It could affect your eyes, in which your eyes will be itching and weeping regularly. It could be your upper airway, in which you have hay fever. So there are different manifestations of allergies in the body.
So asthma is a type of allergy.
Type, yes.
Now, I've heard of wheezing as one of the symptoms.
Yes.
What really is wheezing?
Wheezing is it's an audible sound. That means you can hear it come from the patient. And when you have moderate to severe asthma, you wheeze. What happens is that it's easy because of the tightening, because you didn't let me finish that time.
Okay.
When you have inflammation, there's a tightening of your airway.
Okay, like what we're seeing now on the screen.
Yes, okay. So can you see the redness?
Yes.
So when there's inflammation, there's redness. And when there's redness, there's leaking of fluid into that airway.
Okay, that
There's
airway is
tightening.
becoming
Yes.
smaller.
Yes, because the epithelium becomes edematous because of the fluid that is exuding into it.
Okay.
The muscle surrounding it gets tight. So there's tightening and there's inflammation.
And that looks like mucus.
And that's
in there.
mucus plugging. So those are the three aspects. Now, air wants to get in there. It's easier for air to get in, but for air to come out, that sound of wheezing is trying to force that air out.
Okay, so it's like a whistle.
Yes, because there's trapping of air within your lungs, and you're now going. You can make that sound yourself. Make that sound. Because you must listen, you must know, so that if your neighbor's child or your neighbor is having this abnormal breathing, you will say, I'm sure you're having an asthmatic attack. Because people don't realize it. Asthma kills.
It does.
I have lost a few close friends from asthma. And that is because, particularly in a system that has a poor health system, so there is not easy access to care that is free.
Some of these symptoms
Yes.
of tightness of chest and,
Yes.
and coughing,
Yes.
are they always present even without the attack?
No, they're not always present. They come when you have. That's why I said asthma is a chronic condition.
Okay.
The redness is always there. Then when you have a trigger, what is your trigger? Your allergens that I've mentioned
Like
before.
the house dust mites,
the
the cockroaches,
the eggs, the cockroaches, yes.
different allergens for
But-
different people.
Yes, so an allergen can be your trigger. But there are other things that are triggers, like noxious fumes.
Okay,
You
chemicals.
see that is very organic fumes in a country riddled with generators. You
Okay,
can
so
imagine
it could
the
be as
pollution
simple as the exhaust fumes from a car.
Tokumbo cars, from the generators. Everybody has a generator. Even the barber, the hairdresser, the shoe shiner, everybody. The multi-billionaire with his big house. So there's so much pollution. This can act as a trigger. Dust in an environment, paints, simple things like even perfumes and insecticides can act as a trigger.
Now, in children,
Yes.
we know that children cannot talk,
Yes.
express themselves as well as adults.
Yes.
How early do they actually have asthma? How early is the onset?
Yes.
And how does one discover it in a child?
You see, asthma, like I said, is a chronic, recurrent inflammation. It's a chronic inflammation of the lungs with recurrent symptoms of cough, tightness, chestness, and shortness of breath, and sometimes exercise intolerance or lack of endurance of exercise. We have found now, before we used to say, oh, you have to be above 6 before we can say you have asthma. Even in a 1-year-old child, you can suspect that this is probably asthma, even in a 1-year-old child. Because the risk factors for having these, what you call hyper-responsive airway, that's what's happening. Your airway is too responsive to this, to allergens and to triggers, is genetic.
Oh,
Yes.
they get it from their parents.
Yes, so it is genetic. But there's an interplay of different things. It could be genetic, environmental factors, it could be lifestyle. There's so many things that come in, psychosocial problems that can actually act as a trigger. So now we are finding that children can be tagged as asthmatic even in the first year of their life if they keep on having recurrent episodes of cough and breathlessness. And it's made easier if they are from a family with atopy, that's allergy, if they have some particular markers in their blood that are high, like there's something called eosinophils, that's a particular type of cells that is involved in the asthma inflammation cascade, or if they have high IgE. So there are things we can now measure in children that can tell us, or in infants that can tell us that this child probably is going to be a child with asthma. But we tend not to diagnose asthma from the first episode of wheezing or the first episode of, a bad cough.
Now, if a child is, school age,
Yes.
maybe 8 to 12 years old, and has asthma,
Yes.
can he engage in sports? Because you said something about exercise intolerance.
Yes.
Is it possible for the child to do some sports?
Yes, because you would still have to engage in sports. It's just that you have to take your preventers
Okay.
before you go on your sports run.
Okay, so there are ways.
Yeah, there are
of
ways.
what are these ways of preventing attacks?
This is very interesting because it's very frustrating, like in a country like ours, particularly in the urban areas where there's so much pollution. But notwithstanding, there are still little ways. There's environmental manipulations. We can all work on what they call bed encasement, in that you cover your bed with an impervious material. You know these things they use for canopies?
Yes.
Sometimes they call it Macintosh. So you
And they use them for kids who are still bedwetting?
You've got it. So anybody who has a child who has, or even the adults who have asthma or any form of allergies, they should go to places like Mushin, Agege, Motor Road. They sell things like that there, or Central Lagos, and buy the Macintosh. Measure the length, the breadth, and the height of your mattress, and you must make sure it has a zip. You just don't cover it. You must encase it.
Is this for bed bugs or for the because of the tuft of the mattress?
It's for house mites.
Dust mites.
House
Okay.
dust mite. House dust mite is a microscopic insect that lives on foamy things. And the stool of the house dust mite is what you breathe in when you sleep on your pillows or your mattresses.
So
And
they're
there's-
always there?
Yes, there's no point saying get a new one because it will come and colonize it again,
Okay.
particularly in an area where there's a lot of dust. So the important thing is encase your pillow and your mattress. And you know there's some children, the parents may encase their children's mattress, but they forget
But they
that
leave the
half the
pillow.
time the child sneaks into their own bed to sleep.
Okay.
So it has to be one in which you just do a total, encasement of all the beddings. Clothes must be washed with hot water and make sure that you keep it dry. And then things like flitting using your insecticides and closing up the windows and all. I think we have to find some sensible way.
Some people say that it doesn't matter how long you air the house
Yes.
after spraying insecticides,
Insecticide.
they are going to react.
To it, yes. It is a bit difficult. I think that's a very difficult, because you see, every country must look for its own problem. If you read a standard guideline of best practice for asthma treatments in the UK or in America, there's going to be nothing about insecticides because they don't use insecticides routinely. But I think if one works on putting it in the morning when the children have gone to school, and then having a mosquito proofing and opening the windows,
That would help
after a few
a
hours.
bit.
That might help. And there are some alternative ways of dealing with mosquitoes apart from this insecticides.
How about inhalers? Can they be used as lung preventers?
Yes, that is a very important part, and that is the pharmacological manipulation of or control of asthma. Previously, people just associated asthma with the relievers. That is like the salbutamol, things like salbutamol.
Relievers, that
Yes.
means that
It
their
helps
attack is
to-
already on?
The attack is on, and it helps to open up
The airway.
the muscle that is tight. But we have found now that because asthma is a chronic inflammation, if you do a PM on somebody who has asthma, you will see the airway, that lining is more pink than somebody who does not have asthma. So we try to reduce that chronic inflammation by giving inhaled steroids.
Okay.
So what is done now is you use the inhaled steroids on a continuous basis. There are 4 types of asthmatics.
Like regular medication.
On regular
you don't wait
medication.
to feel funny.
No, you don't. It must be used regularly. And that is a big problem here, is for us to convince health practitioners and also the clients that things have changed in the management of asthma. When I graduated 36 years ago, it wasn't standard there. But now things have changed, and we advise all our patients who have I will tell you 4 groups of people with asthma. We have the mild intermittent. So with them, you just give them their blue inhalers, relievers.
Okay.
So
the
blue
inhalers are color-coded.
Yes. Blue is with the cap of the inhaler. Which is a pressurized, the chemical has been pressurized into a device.
Yes.